Okay, so what we're going to do here is we're going to talk about how to self-mobilize some things. It is helpful if you're sitting for some of this. So if your feet flat on the ground, not up high like I am right now, but just to stabilize yourself. So we're going to talk about first the neck. So if you reach up and across with your opposite hand, you'll be able to feel like just on the outside of your neck here where it might be tight, stiff. Like if you can't turn your head well this way, or especially down here, it feels tight. Maybe coming up across here and just gripping that a little bit. And bring your elbow up to your mouth, like when you cough into your elbow. And you're going to try to move through your body, your torso with this, not wrenching on your neck. You're going to just turn your head and your body, almost like checking your blind spot. You want to get a sense of that flow there. So basically you grip like this, kind of lock it in. That helps protect your neck from over wrenching. And you're going to turn your head just gently with your body like this, or we can go down like this, or we can go up like this, and then you can kind of self-mobilize and stretch, get those tight, stiff segments moving and those muscles stretched out real gently, okay? So that's how you get the upper part in that neck. Now, when we look at the collarbone here, towards the inside, this is where your SCM muscle comes in down here. So if that's not moving very well, you can put your fingers, again, opposite hand work generally works best here, so that frees up your arm. Now, if that's too painful to lift your arm, you can actually slide your arm along the wall, and that will give it some support. So if the hand goes up, this is going to anchor down. So I'm just going to put my hand on top of the inner part of the collarbone. I'm going to lock that down and in like this, like I'm pulling across my body like a seatbelt. And then I'm going to practice reaching up here. Make sure it's not painful. Same thing, out to the side. That might be too much. I might want to shorten my lever arm. And again, I could slide on a wall here too, okay? So those two, it's going to be opposite of the direction of the hand. And then if I go across, now it's going to be same direction as the hand as I go across, or across that way. Same thing here. If I'm coming out that way, that's the same as kind of coming out here. So if I'm having trouble with those no monies, I might have to give a little assistance, a little boost, a little mobilization here. And then lastly, if you go up a little bit higher, kind of more cover across the top, the soft spot here, not pushing deep down in, but just flat fingers across, you can stretch and kind of mobilize that, like in the scaling area here in that first rib. Kind of get that kind of loosened up. I'm not choking myself. I'm just putting those fingers right across the soft spot here and trying to just loosen things up as I go. You can move a little farther back, try to get some of the upper trap. Or if you can go back further, the levator here too. Good ones to try to loosen just manually yourself. Good.